Okay. I thought that you are talking about treatment of hair loss by laser.
And treatment as well.
Okay.
Yeah.
Because these are different, totally two different issues.
Just give us an idea about the
laser in hair transplantation abandoned long time ago. It's useless actually, and actually we have avert effects by using the laser, because when we are making the holes, we need blood. Blood is essential for the healing of the grafts or the hair. While by laser we burn the skin, and we don't have blood in the field where we transplant the hair. So the regrowth rate in using lasers was very low, and it was abundant, I think, something like 15 years ago. It's been tried and abundant. I remember we removed the laser from our clinic, I think, 13 years ago.
You don't recommend it?
We don't recommend. Nobody is using laser now for hair transplantation,
But some people, when they talk about laser, sometimes they mention this.
No, they mention, actually now, recently we are mentioning laser for hair loss treatment. Low-level laser, not for surgery.
Not for transplantation.
Not for transplantation, for treatment of hair loss.
So what are the ways that laser can be used to treat the hair loss?
No, actually, there are different type of these lasers. Sometimes we have combs with laser. We have machines with laser.
The combs with laser, they refresh the scalp?
They refresh the scalp. Actually, it's not proven the results of laser even in treatment of hair loss. It's used as additional treatment for the basic treatments of hair loss for the medicines, but it's not a basic standard for treatment even for hair loss.
Yeah. We are going to stop with the report, Dr. Samir, and Dr. Samir actually surprised us with the two information that the hair follicle and the root that is the part that is affected. It's not our scalp, with the hormone that may cause the hair loss, and also laser could be used in the treatment of hair loss, but not in transplantation, and that's why we are so eager and so keen to have physicians in our program to shed some light upon ideas and problems that we might get confused about. We are going to have this report, and we'll be back to know more about the treatment of hair loss through laser and through other materials. Please stay tuned. Welcome back, and we're still talking about baldness, and hair loss is something that if any one of us face this problem once, they are really hurt, and if they are women, they will be more affected than men when they are prone or when they have a problem about hair loss. With us is Dr. Samir Abu Ghoush, the plastic surgeon and the hair transplantation consultant. Dr. Samir, now you told us about the hair transplantation and through surgery. Is this the best treatment for the hair loss?
For baldness.
For baldness.
For baldness, not hair loss.
Okay, so what's the best for hair loss?
Actually, as I said, hair loss might provide to baldness, might not. We have permanent and non-permanent hair loss, and it depends. Actually, for let's talk about males first, and later we talk about women. In men, most of the problem is genetic. Around 98% of baldness or hair loss is genetic. We have 2%, might be, as I said, chemotherapy, radiotherapy, burns, and what we have, alopecia areata.
And in these cases, can you do transplantation for them?
For post-burn scars, yes. Yeah. For surgery scars, yes, we do. Hair
and for people who lost their hair due to being exposed for chemotherapy?
No. We actually they recover sometimes by themselves.
But you cannot do transplantation for them?
No, because all the scalp is affected. We don't have from where to take the hair.
Yeah.
And it's not permanent. Sometimes it's not permanent hair
and
loss.
You can take it from another person to put it in their hair?
No, it should be from the same person.
From the same person?
From the same person.
And can you take it from any other part of the body?
Yes, we can take from other parts of the body. We do transplant hair from the head, in the eyebrows, eyelashes. We do mustaches and beards.
But it should be from the same person?
Yes, from the same person.
Okay.
And you, also we can take body hair from the chest, from the beard, from different parts of the body, and we can put the hair in the scalp also, in the head.
Great.
And it will regrow.
But it should be from the same person?
From the same person.
Okay.
So in male hair loss or male baldness, as I said, it depended on male androgenic alopecia, what I said. It depended on
the genetic
reason.
Okay.
Depends about the hormones. So we have hormone treatment for that. We have tablets called Propecia or finasteride, which blocks the dihydrotestosterone, which affects the hair follicles. But we have to take this tablets lifetime, and the study shows that we have permanent effect after using this Propecia for 5 years in males, in 90%. That the hair is intact and we don't lose hair.
They can stop the medicine, you mean, after 5 years?
No, they have to continue. But the study were made after 5 years, after using this medicine for 5 years.
You mean the problem would be much, much better after 5 years? They are going to have good results.
But they have to use this tablets actually
and
for lifetime.
Is there any side effect for that medicine?
Actually, they are not big side effects. We have small side effects. Actually, it affects maybe 1% or less than 1% from the men who are using.
In terms
we
of
have
what?
decrease in libido. That libido, that means sex ability or something like that. We call it libido. So it might be affected in 1% or less than 1%. But we do advise men to use these tablets. It doesn't regrow hair. It keeps hair intact.
So the amount that you have, you're not going to lose it.
And we have another treatment also which called minoxidil. We have different trade names for that: Rogaine, hair grow.
We don't like to mention names
no, but
a lot.
It's very well known, this medicine. This is for males. For females, it depends what is the cause of the hair loss. If it's a disease, we have to treat this disease. If we have a problem with the thyroid gland, we have to treat the thyroid gland. If we have
sometimes after pregnancy and giving birth, there's a great hair loss.
No, actually, after delivery.
Yeah.
During pregnancy, we see the hair is
very nice.
Very nice.
Yeah, true.
After delivery, we start to lose the hair. It might be due to blood loss or changes in hormones during the pregnancy and after pregnancy, after delivery. Anemia might be cause of hair loss in females, and so we have to give iron and vitamins. Doesn't cause permanent hair loss usually. If we have ovarian cysts, we have to treat the ovarian cysts. If we have hormone malfunctioning, so we have to, sometimes we have imbalance between male and female hormones in women, so we have to treat all of these reasons. If we have female pattern hair loss, androgenic female pattern hair loss, then we have only one solution, not like in male, because as I said before, we don't know what is the trigger for androgenic female hair loss. So we don't use hormones. We don't use this Propecia for women, although it was tried in States and in Europe without any effect for women, this Propecia.
Without any effect? You mean without good result or without any side effect?
Positive
no
effect.
Positive results.
Positive results for that. So we have only in females what we call minoxidil. Okay, different types of this minoxidil, as I said. This is the only
medicine as well.
Medicine. This is minoxidil. It's a medicine. It's a spray. We have to use this spray twice daily, morning, evening, also for lifetime. Some women, they are using this for 2 months or 3 months and they stop, and they are coming complaining.
Back to the problem, of course.
Yes, we have the